This medicated product is used to cleanse the skin and treat acne and other skin conditions such as seborrheic dermatitis and rosacea. It contains an antibacterial agent and a drying agent that promotes shedding of the top layer of skin, known as keratolysis. It is best to use it as directed by your doctor or as indicated on the product packaging. Apply the medication to the affected area as recommended and ensure to follow the instructions for the best results. This medication is only for use on the skin. Before using it, make sure to clean your face with a gentle cleanser to remove makeup, oil, and excess dirt. If you are using the liquid form, be sure to shake the bottle well before each use. If you are using the liquid cleanser, apply it as directed by your doctor, usually once or twice daily. Gently massage it into the affected skin for 10 to 20 seconds until a full lather forms, then rinse thoroughly and pat dry. If you are using the cleansing cloth, wash the affected areas as directed by your doctor, usually once or twice daily. First wet your face with water, then wet the cloth and work it into a lather before cleansing your face for 10 to 20 seconds. Be careful to avoid getting the lather into your eyes. Rinse thoroughly and pat dry. If your skin becomes excessively dry, you may need to rinse the cleanser off sooner or use it less often. And be sure to avoid getting the medication in your eyes, on your lips, or inside your nose or mouth. If you have any concerns, consult your doctor or pharmacist for further details. And be sure to let your doctor know if your condition does not improve or if it gets worse. If you experience redness, irritation, or scaling of the skin, it's important to tell your doctor. This medication has been prescribed because your doctor has determined that the benefits outweigh the risks. Most people using this medication do not have serious side effects. However, if you experience cracked skin, unusual weakness or fatigue, dark urine, yellowing of the eyes or skin, signs of infection, easy bruising or bleeding, or aching/swollen joints, it's important to contact your doctor right away. If you use this medication on raw or broken skin, you may be at an increased risk for side effects. It's important to consult your doctor for details. While a serious allergic reaction to this drug is rare, seek medical help right away if you experience symptoms such as rash, itching or swelling, dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before using Avar pads, medicated, make sure to inform your doctor or pharmacist of any allergies you may have, especially to sulfa or sulfur. It's important to discuss any inactive ingredients in the product that may cause allergic reactions or other issues. Also, be sure to inform your doctor or pharmacist of any kidney disease in your medical history. If you are planning to have surgery, let your doctor or dentist know about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, it is important to use Avar pads, medicated only when clearly needed. It's best to discuss the risks and benefits with your doctor before using the medication. For breastfeeding mothers, it's important to consult your doctor before using Avar pads, medicated as it may pass into breast milk. When using Avar pads, medicated, it's important to be aware of potential drug interactions that may affect how your medications work or increase the risk for serious side effects. This includes skin products containing silver, such as silver sulfadiazine. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Avar pads, medicated. If someone has taken too much of Avar pads, medicated, and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the US, residents can call their local poison control center at 1-800-222-1222. For Canadian residents, they can call a provincial poison control center. It's important to note that this medicine can be harmful if swallowed. Always keep it out of reach of children and follow the recommended dosage. This medication is for external use only. Do not share this medication with others. It is important to follow the directions on the package and use as directed by your doctor. Always wash your hands before and after using Avar pads, Medicated. Avoid getting this medication in your eyes, nose, mouth, or on healthy skin. If accidental contact occurs, rinse thoroughly with water. Do not use Avar pads, Medicated on sunburned, windburned, dry, chapped, irritated, or broken skin. If you have any questions about how to use this medication, ask your doctor or pharmacist. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same time each day. Do not apply large amounts of this medication, use it more often, or use it for longer than prescribed. Your condition will not improve any faster, and your risk of side effects may increase. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same time each day. Do not apply large amounts of this medication, use it more often, or use it for longer than prescribed. Your condition will not improve any faster, and your risk of side effects may increase. If your condition does not improve or if it worsens, contact your doctor. If you forget to take a dose of Avar pads, Medicated, take it as soon as you remember. But if it's close to the time for your next dose, just skip the missed one and take the next dose as usual. Don't take a double dose to make up for the missed one. Remember to use it regularly. Keep Avar pads, Medicated at room temperature and out of reach of children and pets. Do not flush these pads down the toilet or pour them into a drain. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.